All right, welcome back. 11:22 now on your Thursday. After years of lockdowns and vaccine mandates, a lot of Americans are experiencing vaccine fatigue. But of course, as fall is finally starting to come in, yearly vaccine appointments are coming up again, and medical professionals are making sure you don't skip them. We've got Sarah Overton, the Chief Nursing Officer and VP of Clinical Service with OSF and Employee Health, joining us now. Tell us more about it. Good morning.
Good morning.
All righty. So right off the bat here, tell us a little bit about why we need to make sure we're staying up to date.
Absolutely. So with sweater weather, fall coming in, that's also where we see what we call our respiratory virus illness season. So it's already peaking in some aspects. We've seen an increase of RSV. We definitely anticipate influenza being a little bit more of an implication this year due to the, I would say, relaxing of masking, social distancing that we experienced over the last 2 years with COVID.
For sure.
So we continue to remind people still same things. If you're sick, stay home. What I hear a lot of is, I took a COVID test, I'm negative. Doesn't mean you're negative for any other virus that you could be spreading to your family, friends, and certainly coworkers. So very much encouraging you to always connect with health professionals, look at validated websites such as the CDC, but this year around we always encourage influenza vaccination for those 65 plus or at risk. Pneumonia vaccine is super important, and then we have a new one coming very soon, which is the RSV vaccine.
Gotcha. And now I know vaccine fatigue was kind of something we saw in the headlines the past couple years, maybe not as much anymore, but definitely during those initial COVID vaccine stages. Kind of break down for us, just as a refresher, I mean, what really is that, and why should people try and avoid it as best they can?
So what we really see healthcare-wide is a huge impact with viruses. So as an example, pneumonia affects 9 million people, results in lots of hospitalizations. So that's a huge impact to our healthcare industry, which is still, I would say, trying to come back from the pandemic. Influenza attacks 4 million people. You and I might do well with the flu, might put us down for a few days, but really what we see is those immunocompromised, at-risk young children, they really get impacted, and it leads to death.
Absolutely. I mean, that alone is as important as it gets, right? And you were mentioning RSV as well. I just wanted to touch on real quickly. I believe there's a vaccine that's in the works right now, correct?
Correct.
What's going on with that, and why is it going to be important to get that when it comes out too?
So RSV is really attacks our newborns, young children, and so for several years we've done what we call a monoclonal injection that's given over a 3-month period. It's called Synagis. So for anybody who has had premature babies, babies with heart conditions, lung conditions. I myself was a mother of premature twins. They got Synagis throughout the RSV season. Now we'll be able to be proactive and give this to all newborns. So that'll be probably coming here in the next few weeks to months. And we're coordinating with our hospitals so that we get those vaccines administered to children. Newborns in the first week of life, so critically time important. And then we're also investigating a utilization potentially in our pregnant mothers, and then of course in the 60 plus category. So again, it's those compromised health conditions, heart failure, COPD, that really lead to increased hospitalizations and ultimately a lot of deaths, which could be avoided.
Absolutely. You wouldn't go into battle without a suit of armor, right? You don't go through life without proper protection. Sarah Overton, thank you so much for being here this morning.
Thank you.
Absolutely.
Appreciate it.
All righty. We'll be right back in just a little bit. Stick around.